The Union for Hospital Workers says it's not good enough that patients at Dunedin Hospital's crowded eye clinic were forced to sit on the floor waiting for their appointments, whilst one waited 7 hours without being seen at all, despite the Southern DHB saying it only happened once. The union says it's been going on for months. Here's our reporter Lydia Anderson.
The DHB has been trying to clear a waiting list of thousands of delayed ophthalmology appointments that have built up over the last year. At least 14 patients suffered moderate or major loss of vision late last year while waiting for follow-up eye appointments. But a Public Service Association spokeswoman, Julie Morton, says the DHB's haste to clear the backlog has seen patients, some of whom are elderly, having to sit on the floor in a crowded waiting room.
There's not enough places to sit down, and my issue with that is it's just not appropriate to put patients on the ground, and secondly, it's a health and safety matter. You're then blocking doorways and egress and all kinds of things.
The DHB's Chief Medical Officer Nigel Miller said in a statement patients had to sit on the floor on one occasion last month when the DHB ran an extra clinic and saw 140 patients in one day after securing a locum at short notice.
We acknowledged the clinic on June 6 was very busy and the waiting room became very crowded. This was not ideal and apologised to any patients who were inconvenienced by this. We are working extremely hard to reduce the time patients are needing to wait for ophthalmology appointments.
But Julie Morton argues the situation was not a one-off.
This is happening all the time. That's not happening once.
She says clinic staff themselves are under huge pressure dealing with the numbers of patients.
Those are our members who, have to front that because there's nobody else there to do it. And so they're also suffering from a bit of, very unhappy patients at times too, who are there for very long times. There was one person that was reported to me from a member who had waited 7 hours and finally gave up and left.
Dr Miller said about 15 locum clinics have been held this year, and all except the one last month involved reasonable lead-in times. He said extra seating had been ordered but did not arrive on time for last month's clinic.
It was unfortunate the additional seating that had been ordered did not arrive in time for this clinic, and again apologise for any discomfort this caused. However, we do now have additional seating.
RNZ News asked the DHB how many patients are still waiting for appointments, but it said it was unable to provide a response today. In Dunedin for Checkpoint, Lydia Anderson.